myself Dr. MBJ. I am a surgical oncologist Aiims Delhi. अभी आज जो केस है दैट इज ए कोलोन कैंसर. नॉर्मली आपको मालूम है जो कोलोन कैंसर का कोई भी कैंसर जो मेटास्टेसिस होता है, स्प्रेड होता है, तो उसको स्टेज 4 बोलते हैं. स्टेज 4 मल्टीपल ऑर्गन इन्वॉल्व होते हैं. बट इनिशियली वो टर्मिनल डिजीज कंसिडर करते हैं आज से 1 डिकेड पहले. बट अभी भी बहुत सारे सेंटर 90% सेंटर इन इंडिया they consider it as a terminal kind of disease. So they send the patient home and they take the care of the last care sort of thing. They say just घर में जाओ सेवा शुश्रूषा करो. Like this kind of word they use. But this kind of patient also get cured. Today that patient I will talk about, she is only 42 years old female. She is from West Bengal, Durgapur. And she also lost her every hope life because she went every hospital, they returned this thing, she underwent so many cycles of chemotherapy. Despite of that, there is no improvement and it was increasing gradually, and she was about to die within 3-4 months. But fortunately, she came to us, our hospital. Initially, medical oncology, they also started another line of chemotherapy. Then the patient anyway come to me for the assessment of any way that is possible or not. Initially, that time I was not there, interpretation was going on. Initially, our team just discharged the patient because that seems inoperable because of as per the CT scan, PET CT. But when I came back, fortunately the patient wanted to meet me and they met me, and I decided to open because I already convinced them the patient also going to die. Why not to take a chance? So they already convinced, and ultimately I did the operation in 2 stages because that is a huge operation, and the patient is 42 years old, may not tolerate this kind of surgery in a single stage. So what I did this 2 stages surgery. Initial stage I removed all the big tumors, chunks tumors. And because that time hemodynamic patient unstable हो जाता है, blood loss हो जाता है, बहुत सारा problem होता है. So next another after 2 days when patient is stable, then I do the complete surgery. That come our way. You cannot just accept the once in life. So that is my question.
So I must say that it is a really incredible task that you have done. Sometimes it might be difficult for you as a doctor to gain the confidence of the patient sometimes.
So that I always believe because I already done 15,000 surgery like
right.
this way, so I can take maximum challenges and I know this thing how to tackle, and I can come to know when it is inoperable.
Right.
So I myself believe like when I say it is inoperable means nobody can should touch this thing because that is my confidence and my experience level. And I did so many surgery like this life-saving surgery and so many like multiple organ I dissected. Initially also I just operated one. Suppose there are 4 type intestine, 4 parts of intestine I dissected, and usually people do only one. So that kind of challenge we could take with our experience only. So it could be possible like this. That is possible.
Sir, how common are colon cancers and
colon cancer is present? This is the 3rd common cancer in the female
causes
and 6th common cancer of male in at present in India. So gradually it is increasing because our lifestyle is one of the important factors because our food habit, meat intake, particularly red meat intakes, and fast food habit, sedentary habit. Even I always say that not only physical irritation, that mental irritation, chronic mental irritation also lead to cancer. So these are also so many factors contribute to this.
so why is more common in women?
Women, that is most common is women, that is genetic one is the important part is the genetic common is there, and right sided colon cancer one is called hereditary colon cancer or Lynch syndrome. That is in the right sided colon, normally elderly people having this thing because of the genetic region. Other region of this thing, most of the people, most probably sedentary habits are there, that is the thing, and the food habits also nowadays they are not having their own food and taking from the outside, there is a constipation is there, more increase. These kind of all multiple factors is related to the colon cancer.
So you said most of the diseases are lifestyle diseases. So how one can prevent such colon cancer? Like one can change the lifestyle, one can adapt some like yoga, meditation. As you are being a doctor, you are also adapting that lifestyle. So is there any message that you would like to give?
Definitely, I say being a cancer surgeon in the Premier Institute, 80% cancer is preventable disease. If you have diabetes, if you have hypertension, you have to have the lifelong medicine. But in cancer, 80% preventable. Why? I can say example because 30 to 40%, even up to 50%, that is cancer is related to tobacco related products, including our pollution also, anything including alcohol. So that is 40 to 50% responsible, and 30% our lifestyle. Rest of the things is the chronic infection and our mental irritation. I say always, and another genetics are there. So main common 80% in our hand, like our tobacco related product we should avoid, and our healthy lifestyle. Even obesity itself causes 20 cancers. Obesity itself. If you just try to avoid the obesity, change your lifestyle, regular exercise, minimum 30 minutes per day, and for 5 days in a week. So that is called regular exercise. You have to do, because I believe if you don't walk today, you have to run tomorrow. So that is true, and that is very important thing. You have to take care of your food habit, and you have to take care of your physical. So physical means you have to do exercise. That is the integral part of our body and mind.
Sir, in this particular case, what additional treatment will the patient need?
So additional treatment, we remove the tumor. Already patient underwent chemotherapy. If the tumor is also there, we like to give the continuation of the maintenance therapy. The maintenance chemotherapy we like to give again.
So chemotherapy will continue?
Continue. The chemotherapy, few cycles chemotherapy to be given. So that depends on the how much cancer is there in the other organs we already resected. So we will calculate on that, so we can give the chemotherapy. So this kind of patient coming to us, this is not that patient. I will come later, because how we are tackling this kind of patient.
So late stage में आते हैं.
These late stage में आते हैं, because here 90-95% patient are in the late stage, because when other hospital just refer them here, they are unable to do anything for that patient. They come to Aiims for the last hope, because that is the last hope. And one important thing in the surgical oncology, their selection criteria. But we don't have that selection criteria, because we cannot choose the patient. You do, I cannot do this thing, because that is the last hope. So we take risk in this patient and challenges. So this kind of patient, how you see is lying down in the ward like this kind of patient, right? So this, yesterday I operated this patient. You cannot see this thing, what other organs are there. Yesterday just operated, that is different altogether. So you cannot see this. When you open the abdomen, you cannot see this, where you have to go like this. You go all the colon, bladder, liver, all are there together like this. So very difficult to do. Yesterday I just finished this case in around 10:30 at night. Because this is the case I wanted to show how we did, but this is not the case. I will come later for this, because this kind of tumor I remove also, like this is also 17 point something kilo was there, young female. This kind of tumor you can see, and I got a traction injury in the shoulder, when I just had a 12 o'clock night, that time Nijja Vandamam was there. And she was witness of this tumor. So I was pulling up this thing and got a scratch in my shoulder, and this kind of tumor I removed initially.
Imagine.
This is regarding this patient, like which I am going to talk about that. This patient underwent that medical oncology registration done on 30th July, because she came back from the different center from the West Bengal, and ultimately 30th July she has been registered in medical oncology for the second line chemotherapy, because the first line chemotherapy not working on that. And under us also, just for the formality, that under us in 25th November 2025 she has been registered. So this is the concept.
है कि ये ज़्यादातर ये जो कोलन कैंसर ये महिलाओं में ज़्यादा देखने को मिल रहा है.
अच्छा नहीं, ये कोलन कैंसर महिला में ज़्यादा मीन्स अभी दैट इज द थर्ड कॉमन कैंसर इन द फीमेल, एंड पर्टिकुलरली राइट साइडेड कोलन कैंसर कॉमन होता है फीमेल, एल्डरली फीमेल के लिए कॉमन होता है, जेनेटिक कॉज होता है उसमें. एंड इवन द लेफ्ट साइडेड कोलन कैंसर नॉर्मली यंग मेल को दिखाई देता है, बट मेल कैंसर में 6 नंबर में आता है एट प्रेजेंट, एंड फीमेल में 3rd नंबर में आता है. सो इतना कॉमन हो गया है, बिकॉज डिफरेंट लाइफ स्टाइल डिसऑर्डर है. वन ऑफ द लाइफ स्टाइल डिसऑर्डर लीड टू दैट कोलन कैंसर.